Hello, and welcome to Discovering True Health, your weekly deep dive into health and wellness. Thank you so much for joining us today. Before we get started, as always, please hit the subscribe button. It helps us out a lot, and you'll stay up to date on all our upcoming shows. And you can also check out additional information on our website, Instagram, and Facebook. Those links are all below in the description. So, according to a 2022 study, iodine is one of the most common nutrient deficiencies and is estimated to affect 30 to 45% of the world's population. Now, why is this important? Well, iodine is essential for the function of every cell in our bodies and is also linked to our thyroid health. Our thyroid produces the hormones we need, and it plays a role in many important functions in our body, such as heart function, muscle and bone, digestive function, and brain development. There's also a link between greater toxicity effects from the chemical fluoride that's added to our public water supply here in the US and lower levels of iodine. So today we'll be discussing causes and symptoms of iodine deficiency, how it affects our thyroid, fluoride toxicity, and cholesterol, and what the best testing foods and supplements are to improve our iodine levels and our health. So my guest joining me today is Dr. David Brownstein, a board-certified family physician and world leader in holistic medicine. He lectures internationally and has authored 16 books. And Dr. Brownstein is also the medical director of the Center for Holistic Medicine in West Bloomfield, Michigan. So thank you so much for joining me today, Dr. Brownstein.
Thank you for having me, Christy.
Now, I'd love to start out with hearing about your journey. You started out as a conventional doctor and went through med school and then did this transition into holistic practice. So can you tell us about your journey and what was the catalyst for the shift?
Well, I had wanted to be a physician my whole life as a young child, and I was fascinated with the human body and, decided I wanted to be a family physician. I saw my family doctor a lot because I had a severe case of asthma when I was young and through my young adulthood years. So I cleaned up my act and got my diet and hormones balanced, and the asthma went away. But back then, I had no holistic leanings. We didn't go to holistic practitioners. We went to the doctor when we were sick. We took what the doctor told us. We were a conventional household. We never questioned anything. And so I went to the University of Michigan for undergrad, Wayne State University School of Medicine, and then I did a family practice residency in Southfield, Michigan. So I finished my residency and I started practicing conventional medicine. I never questioned anything I was taught. I used to tell people, and my mother-in-law in particular, there's no reason to take vitamins or nutrients because you're just making expensive urine. And we get all the nutrients from our food, and nutrient diseases and deficiencies are things of the past. And about 6 months into practicing conventional medicine, I was in private practice. I was negotiating a buy-in for a partnership at that time. I wake up I had a couple of sleepless nights for an unknown reason in a row, and I get up after 2 nights of not sleeping very well, and I'm getting ready to go to work, and I blurt out to my wife, Allison, I don't want to be a doctor anymore. Now, she's known me since I was 18 years old, and that's all I talked about. It was my drive. That was my passion. That was what I thought I was put on this earth to do. And she said, first comment was, she was incredulous. We had $100,000 in student loans. This is all we had aspirations for. And, her second comment was, well, what are you going to do about it? And she said, what's wrong? And I said, all I'm doing is treating people with drugs to treat symptoms. I said, I'm using more drugs to treat the problems than the first drugs. And I don't think people are getting better. And I can't do this for the next 30 or 40 years.
Wow.
And she said, well, why don't you do another residency? Like, one of those was enough. I was floundering at the time. And anxiety kind of grabbed me a little bit. And around that same time, I had a patient who was bothering me to meet his chiropractor. And he said that his chiropractor really helped him out with his health. And it was more than just adjusting his bones. And he said, this guy changed his life. You should meet him. And, I pushed him off, and he was his wife and my wife worked together, and we'd done something socially with them, and we were friendly. And I had that morning when I told Allison I want to be a doctor and I went to work, he came as a patient, and he again brought up the chiropractor to me. Now, at that point in my career, I never referred to chiropractors. I never knew what they did, never been to one, but I used to tell my patients, don't go see them because they're dangerous.
Right.
And that's what we were taught in med school,
Right. That's
so
quackery. That's quackery.
I didn't know about it, so it doesn't exist. It wasn't taught to me, so it didn't, there was nothing there. So I was, in my anxious state, in my lack of sleep, I took his number from that patient and I called him after work that day. We set up a dinner meeting the following week. That day rolls around and I'm still not sleeping, and I'm, really floundering at that point. And I tell my wife when I get home from work, I'm going to cancel dinner with the chiropractor. And she said, why? And I'm like, because he's not going to, it's a waste of my time. And she goes, it's too late. You had the schedule for a week. You need to go and be nice. So I went. He was a nice guy. He was super smart. He knew more functional biochemistry than I knew by far. And he was talking about biochemical pathways and in functional terms that, we learned biochemistry in undergrad and medical school, but you didn't learn it in a practical way that you could utilize it with your patients. You just learned it to pass the test.
Right.
And his name was Dr. Robert Radke. Him and I became, best buddies and friends and colleagues, and we referred patients back and forth from that moment on. And he brought me a book at that meeting. It was Healing with Nutrition by Jonathan Wright, who's an allopathic physician. And I took the book home and I opened the chapter. I got home around 10:30. It was late for me, and working the next day. And I started reading the book, and I focused on the chapter on heart disease. My father had his first heart attack at 40, second heart attack at 42. During the next 20 years, he was 2 bypass surgeries, a couple of angioplasties. He was on 12 medications for diabetes, hypertension, congestive heart failure, and heart disease. And he looked awful. He was pale and pasty. He was having continual angina for over 20 years, taking medications daily for that. And he looked like he was going to die at any moment. And we were all kind of waiting for the phone call that he had died. So I called my dad in the office after reading that chapter a few times that night. And by the way, I went to bed about 3 a.m. that night because I was reading that book. I was actually excited about something for a change.
Wow.
And I called my dad in the office and I said, I want to draw some blood work on you. And before he left for work. And so he comes in and I get some blood tests. When I get him back a few days later, I put him on 2 things. I put him on natural thyroid hormone and I put him on natural testosterone. His testosterone levels tested below detectable limits, so near 0. His thyroid was in the reference range, but in the lower part of the reference range. And within 7 days of starting both those, his 20-year history of angina melted away, never returned. He felt better. He was pale and pasty looking. He turned pink and healthier looking. My dad didn't change any of his bad habits, and he had a few of them. Could eat like the best of them, and he was smoking cigarettes and never exercised a day in his life. But he looked and acted better. 30 days later, I checked his blood work again, and his cholesterol in the 300s on medication fell below 200 without changing any of his bad dietary habits. And his friends were asking him and my mother, what are you doing? He looked so much better. And once I saw the changes in my dad, I knew that's what I wanted to do in medicine. And I went to the partners in the practice and I said, I need to leave, and got rid of the lawyer. Now, my wife was pregnant with our first child any day now at that point. And they said, well, what are you going to do? And I said, I'm going to do holistic medicine. And they said, what's that? And I'm like, I don't really know, but I'm going to figure it out. And they said, why don't you just do it here? We like you. And I said, I can't do it here. I need my own office where people answering the phones and the nurses and the file people and the other doctors or practitioners, we're all on the same page. We're all trying to do the same thing. I knew that.
Yeah.
And, that's how it started. And since then, every patient got a full hormonal evaluation and full thyroid evaluations, it's been a good ride, and it's been a 30-year ride. And my only regret is I wish I had the leanings that I have now when I was in med school, and I could have, maybe started a little bit earlier. And but really no regrets. It was good to learn the conventional side, And it's been great to keep learning the holistic side, which I'm still learning every day from my patients.
That's an incredible story. And it's incredible, but it's also really scary because it makes you think, I mean, your dad was this ill for so long and no MD ever thought to test him for those particular things. I mean, are these things you don't learn in med school or?
No, you don't learn the correlation. You learn about thyroid,
Right.
and do you learn about thyroid and heart disease and thyroid causing high cholesterol? I don't know if if you learn it, it's quick and it's done and it's gone. They don't emphasize it.
Right.
But you don't learn sort of how to diagnose people appropriately, and do a proper clinical exam and a proper history and things. What you learn is how to order lab tests and then how to prescribe the one drug to treat the problem that you find in the lab test. Problem is the one drug turns into two drugs and three drugs because you're treating the symptoms of the
Of the
drug
other drug.
with other drugs.
Right.
And
Spiral.
but no one had checked my dad for testosterone levels ever. And I didn't know, I really didn't know at that point there was a big correlation with low testosterone and heart disease. No one had bothered to do a full thyroid panel on him. They had checked a TSH level, which is all they did back then. And his was normal. And his was normal when I checked it. It was in the reference range, but it was in the upper part of the reference range, which, it's just not, it had all the other signs of hypothyroidism and clinical signs of it. And so he was not given a proper evaluation. And he was seeing the best cardiologist in the area. He was seeing, he had a good internist. And it's the way medicine is. And it's become worse,
Yeah.
recently.
Yeah, with all these kind of regulations coming from top down, I feel like everybody's even more boxed in. Were there any red flags like while you were in medical school, or maybe looking back now, that when you look at, you mentioned the whole, well, we didn't learn how to really diagnose, we just learned how to, diagnose for a prescription. But were there any other red flags that kind of, now that you're in holistic, that you're like, we should have learned these things in medical school?
What you learned in medical school was pathology, and you did learn how to diagnose pathology, and that was good. And I still use it today. I still use the basic method of taking a history, doing a physical exam, ordering lab tests, and then trying to put the whole picture together. You do learn that method, which I think is valuable. You do learn about pathology, but what you learn is once you make the diagnosis, there's usually one drug or one drug class that is required for that diagnosis, and that's it. There's no mention of what's the underlying cause of it. It's almost like the underlying cause of hypertension is a lack of antihypertensive medications,
Right.
or the
Lack
cause
of
of diabetes is a lack of diabetic medications, and that's not true. There's other underlying causes of that if we treat that, perhaps they don't need the hypertensive and diabetic medications. And that's the problem with the medical training right now. It's been captured by big pharma, and big pharma's job is to make money for the shareholders, and they make money for the shareholders by selling more drugs. So it's all drug based. And if the drugs treated the underlying problem of our major health issues, maybe that would work. But that's just not how it is. I mean, if you have, there's very few drug therapies that treat the underlying cause of the illness. An example of that might be pneumonia. If you have bacterial pneumonia, I am all for using the proper drug to treat the strain of bacteria that you find in the lungs, if you can find it, or the strain of the bacteria you find in the bronchioles for the bronchitis. And, you can use vitamin C and vitamin A and vitamin D and iodine and some other things to help the immune system at the same time. But, I'm all for using the appropriate, in this case, antibiotic to treat that infection when you find it. But for things like hypertension and diabetes and Alzheimer's and Parkinson's and things, there's no particular drug, the deficiency causing this, and there's no search for what's causing it. And so, it's a problem, and doctors have a fundamental lack of knowledge of nutrition. They're just not taught it. I remember in med school, we had a 3-hour course on nutrition. That was it. Now, I must have had some inkling to that because I studied hard in med school. I worked hard for it. It didn't come easy to me, and I worked hard. I didn't go to that many lectures because I was studying, and I was not screwing around, but I was studying. But I went to those 3-hour lectures, and basically the lectures were, the example was, they presented vitamin C, and they said, scurvy is a disease caused by severe vitamin C deficiency. Scurvy is a thing of the past.
Right.
And because food is fortified with vitamin C, so we don't see it anymore in our world. And they went on to thiamine. Thiamine is vitamin B1, and beriberi is a deficiency of thiamine, and you get congestive heart failure and things like that. That's a disease of the past because we fortified our cereals and our grains with thiamine. And it was like that.
Wow.
And there was no mention of subclinical scurvy, which I see all the time, and I still see scurvy because I check vitamin C levels in people. I still see thiamine deficiency, and I see niacin deficiency. I see them all because I'm checking for it, and I'm checking levels, and I'm in tune with it. The problem is not the focus of med school at all. 3 hours in 4 years is clearly not a focus. And
Right.
the only thing you were tested on about those vitamins were what's severe vitamin C deficiency? Scurvy is the answer. What causes beriberi? Thiamine deficiency. That was it. It was a question here or there. And that was gone. You were busy memorizing drugs and, diagnosing pathologies and the one drug to treat that pathology. That was the focus of med school. And having 2 daughters just graduate from med school and, they're senior residents right now, it's gotten worse because I've been able to witness, 30 years later, their journey through it.
That's terrifying. And you mentioned chemistry. I in my last article in my series for the Epoch Times, I spoke to, he's a PhD in chemistry, and he was a former NIH researcher. And when we were talking about fluoride and the chemistry of it, that was really where it was at. I was like, okay, this is a whole nother level to the talk on fluoride when you know the chemistry of the body.
So I know we're going to talk about iodine, and I'll talk to you about chemistry with iodine and fluoride because they're similar, they're in the same family together.
Yes.
And when I had that dinner with Dr. Radke, the chiropractor, that's what he was doing. He was talking about the chemistry and the biochemistry. And I'm like, I didn't have any knowledge of that. I'm like, I was really irritated after that dinner. Like, how does this guy know not only 10 times more, 100 times more than me? Why wasn't I taught this?
Yeah.
And and that's, that was my start. I'm thankful I went to that dinner, and thankful for Dr. Radke for opening, at least opening a door for me to walk through it. Thankful I walked through it. And
right. Thankful that you had an open mind to it, because I feel like a lot of doctors wouldn't have an open mind to it. Now you wrote a book on thyroid, and a book on iodine. You've read quite a few books, which is a huge feat, and found that iodine is crucial for thyroid function. So let's start with understanding thyroid first. What's the function of thyroid, and what happens if it's not functioning optimally?
So the thyroid gland sits here in the lower part of our neck. It weighs about 1.5 ounces, and it produces a teaspoon of thyroid hormone for a whole year. So thyroid hormone is essential for every cell in the body. T4 or thyroxine is an inactive thyroid hormone, and T3, triiodothyronine, is the active form of thyroid hormone, both produced in the thyroid, and more T3 is produced in the rest of the body, or transformed from T4. But we can't live without thyroid hormone. And so medicine has recognized that, and they after treating my dad with thyroid hormone and seeing his cholesterol in the 300s fall below 200, and then reading how it's well known that hypothyroidism causes high cholesterol levels. So perhaps all these people taking statin drugs, like they have a statin deficiency syndrome because their cholesterol's high. Maybe they don't have a statin deficiency syndrome, because I haven't seen one of those patients in 30 years. But maybe they have a thyroid problem. And when you get your thyroid rebalanced, the cholesterol comes back to normal.
Wow.
And lowers. So this little gland here, butterfly-shaped gland, has to produce enough thyroid hormone to maintain the metabolic rate of every single cell in the body. When it underperforms or underproduces thyroid hormone, a condition called hypothyroidism comes up, where the symptoms of that are fatigue, which is the number one complaint I hear from everybody out there. But fatigue, brain fog, coldness, hair loss, weight gain, hypercholesterolemia, high cholesterol levels, and a whole host of other problems sort of related to fatigue and brain fog. And the conventional lab tests are the reference range is just too wide. It's like this from 0.5 to 4.5 when it should be more like this. And so when I wrote my book, Overcoming Thyroid Disorders, was that, the big problem with thyroid came in the 1970s when the TSH test was developed. And when doctors before then used to rely on clinical exam and, doing a proper history and exam and then making a clinical diagnosis of it and treating it. In the 1970s, when the TSH test came out, all the medical societies mandated doctors follow the TSH levels. And so a whole bunch of patients at that point were not properly treated for thyroid problems. And the consequence of that now is a couple generations later, we have this huge proportion of people walking around who are hypothyroid who don't know it, and they're being mistreated and treated with drugs like statins and other things. And diabetes is another thing that kind of goes along with low thyroid state, and weight gain. And 2/3 of our country is overweight, 1/3 is obese, and there's many causes of that, but I think hypothyroidism is part of that cause of that. So a proper holistic evaluation of thyroid, which includes doing a history and a physical exam and lab tests, and then interpreting things a little bit differently than how you're taught in med school, is just a better way to treat patients. I can say that with authority after three decades of doing this.
So this test was too broad. So instead of it being diagnosed as thyroid, which it should have been diagnosed the root cause as, it would say, oh, you need a statin for, it would basically diagnose as other things that weren't the root cause.
What we're taught in med school, what was taught back then and still taught today, is if your TSH is in this reference range, which is too large,
right,
you don't have a thyroid problem. So you're cold, you have high cholesterol, your hair's falling out, you're gaining weight, not because your thyroid's off kilter, but because something else. So what do doctors treat them with? They, it's interesting. When I lecture to med students and doctors, I sort of present this case and I said, well, what's the first thing people go to when, they have all these symptoms of hypothyroidism, and yet the TSH is in that reference range, maybe in the high part of the reference range. And then the inactive and active thyroid hormone, T4 and T3, are in the lower part of the reference range, clearly indicating you've got a thyroid problem, but they're in the reference range, so doctors don't treat it. What do they treat them with? Antidepressants is number one in there. Statins is number two in there, because these people are tired and fatigued and they get depressed.
These are the symptoms they're treating them for now, not
their. And it doesn't help the underlying cause of the problem. And this is perpetuating on and on and on, and it needs to stop. And
so what would you say for those listening? What are the main symptoms they should look out for that they could possibly have a thyroid issue? And then what sort of testing do they need to be asking for?
The symptoms are, as I said, fatigue, brain fog, hair loss, weight gain, sense of coldness in the hands and the feet and the nose, heart disease, diabetes, all these things. And the lab tests are important, but conventional, when I was in training, you were taught just do a TSH test. And really, it didn't really matter. Didn't matter what the patient complained of, didn't matter what I found in physical exam, didn't matter if the thyroid's sticking out of their neck. If their TSH was normal, they don't have a thyroid problem. They don't need thyroid hormone. That was what I was taught. Now they expanded a little bit where they check a T4 and a TSH, but it's not enough. So they don't do a full thyroid panel. A full thyroid panel is a TSH, a T4, free T3, reverse T3, and then thyroid antibodies. And I believe everybody with any of those symptoms should get those same things. Should get those same tests. And for my patients, when I see them twice a year, which is what I do for most of them, that's a test they get twice a year, ongoing.
And speaking of which, you are in Michigan. Do you do tele-appointments or do you just do in office?
I do not do tele-appointments. I did tele-appointments during COVID. I did not like it. Right. And I will do tele-appointments after I see someone once, but I need to see them. I found with tele-appointments, there's a face-to-face something that needs to be done in my world, so I can connect with that patient and feel them and touch them. and they get to connect with me. And I can't do that. I can't do that with televisits, with solely televisits. It just doesn't work for me.
That makes sense. Now let's add another piece to the puzzle. How does iodine come into play with our thyroid function? And does iodine play any other important roles in our body function as well?
So after my dad, everybody got a hormonal evaluation, full hormonal evaluation, which included thyroid hormone, and everybody got thyroid hormone evaluation. And I was going to courses, and I was reading, and I was, whatever, working at
Fully immersed.
I started treating a lot of my patients with thyroid hormone, diagnosing them with thyroid hormone. And I would say in the first 10 years of my practice, about 3/4 of my patients were on small amounts of natural thyroid hormone. Now they were feeling better. I thought I was doing good medicine. But over those 10 years, it was bothering me. Why are so many people needing thyroid hormone to feel better, to feel warmer, to get their hair loss to stop, to lose weight, to, get fatigue and brain fog better? And I don't, I questioned this over that time. I mean, I saw the results, but I was questioning it because I didn't think we were designed by our maker to need thyroid hormone just because we're getting older. I thought we were designed pretty well if we give the body its basic raw materials, good nutrition and water and, the raw materials, and we should do pretty well with things. But over those 10 years, there were 2 articles that came out that showed women who took thyroid hormone, T4, or Synthroid or Levothyroid, for at least 10 years had more cancer, breast cancer, than women who didn't take thyroid hormone. Now, that didn't make sense to me. I thought lack of thyroid hormone predisposes you to cancer. Why would taking thyroid hormone? These people were what I thought were low in thyroid hormone. They were taking thyroid hormone for it, and now they have this 50% increased risk of cancer. So that didn't sit well with me. There were 2 studies that came out by a researcher out of Philadelphia, Bernard Eskin, and I looked at those studies, and I'm pretty good at reading research studies and statistics, and they were pretty well done, and that was really bothering me, and I couldn't come to a reason for that. And then around my 10th year practicing holistic medicine, I kept looking at iodine. I kept looking at what are the things that feed the thyroid. Why are people underproducing thyroid hormone and having all these symptoms? So let me give them the nutrients they need to produce more thyroid hormone. So I went back to my biochemistry books, my physiology books, and
maybe there's another root cause.
And so I started looking at, and you would see things like magnesium and vitamin C and iodine and selenium, all important to make thyroid hormone. So I would put people on magnesium, selenium, vitamin C, iodine. They didn't feel nearly as good as when they took thyroid hormone. And I couldn't get them off thyroid hormone, and by putting them on those nutrients, because every time I tried to do that, they didn't feel as good. They weren't happy, and they didn't want that. So I kept coming back to iodine and kept studying it. And iodine's a really interesting element. And whenever you bring up iodine to anybody, doctors, lay people, nurses, everyone's ears perk up for some reason about iodine. Everyone's interested in iodine. So I live in Michigan, bordering the Great Lakes, which is Michigan, Indiana, Illinois, and Ohio, and Canada to the north. And it's been well known for 100 years, over 100 years. We live in the goiter belt of the United States. The Great Lakes area, the soil is one of the most iodine deficient areas of the world. As you mentioned at the beginning, iodine is an essential element we can't live without. Every single cell in the body needs and acquires iodine because it can't live without it. And one of iodine's main jobs in the body is to maintain the normal architecture of the glandular tissue. So if I call this the normal architecture of the glandular tissue, and the glandular tissue I'm referring to is the breast, the ovaries, the uterus, the pancreas, the prostate, and the thyroid gland. If this is normal architecture, it's normal. There's no masses, there's no weird growths, it's just normal. In iodine deficiency, the first thing that happens is cysts form in these tissues. And if it goes on longer, these cysts become hard and nodular. Goes on longer, they take a hyperplastic appearance if you take a biopsy of them and look at them under a microscope. And cancer is the end of that road. This continuum has been shown for over 75 years in medical literature. And In the thyroid gland, goiter is a sign of it, or swollen thyroid. The breast tissue, fibrocystic breast disease, which by the way affects over 80% of US women. It's a precursor to breast cancer. It used to affect 3% of US women about 70 years ago. Now it's over 80%. It's around 88%. We have 1 in 7 women with breast cancer. We have 1 in 3 men with prostate cancer. We have thyroid cancer. It's the fastest growing cancer in the United States. We have epidemic increases of ovarian and uterine cancer as well. And pancreatic cancer. We all know people with pancreatic cancer these days. And I say the problem we're getting is part of this iodine continuum. And the reason we're seeing such a rise in cancer is caused in a large part from this iodine deficiency epidemic that has just taken hold of our country. So I studied iodine over the first 10 years, and I knew our iodine levels were falling because I was following the National Health and Nutrition Examination Survey the US government puts out every 5 to 10 years. And really over the last, since 1970, so 50 plus years, iodine levels across the United States have fallen over 50%, close to 60%. So we went from being an iodine sufficient country from the WHO criteria, which I believe are way lower than we need, to being an iodine deficient country. And during that same time, we've seen this epidemic rise of all the cancers and all the thyroid problems, from hypothyroidism to autoimmune thyroid disorder to Graves' disease, all caused by lack of iodine, from what what my research has shown. So, for the first 10 years of my practice, I was mostly putting people on thyroid hormone. I would try iodine in small amounts, medium amounts, large amounts. It didn't work. They still needed thyroid hormone. They didn't feel worse, but they didn't feel better. And then year 10, there's an article in one of my journals that I get, and a doctor had developed an iodine loading test. He's in California. His name was Dr. Guy Abraham. I called him up when I saw the article, and it's a long story to get him to trust me because he didn't trust anyone at the time, but I went through a lot of pain.
I'm sure if he's writing about things like iodine, he's
He
getting
was slapping me around. He didn't trust anybody, but he eventually gained his trust, and he became my mentor in iodine. I would fly out to California 6 times a year to work in his lab for a long weekend, and we began studying. He began teaching me about iodine, and what he taught me initially was I was using the wrong form of iodine in my patients. I was using iodide, the reduced form of iodine. That when you use that, the different cells of the body require, or not require, but preferentially need different forms of iodine. So the 2 major forms of iodine are the oxidized form iodine, the reduced form iodide. And so once I realized that, I started using a combination of iodine and iodide in the form of Lugol solution, or tablet of Lugol solution. All of a sudden, I started to be able to lower thyroid doses down. I was putting them on this combination of iodine first before thyroid hormone. And quickly, within a few years, I went from 75% of my patients on thyroid hormone to 25% requiring thyroid hormone. And of those 25% that required thyroid hormone, my average dose used to be about 2 grains or 120 milligrams of natural thyroid hormone. Now it was 30 milligrams. And so I was able to reduce the amount of thyroid hormone those needed. And I got about 50% of those patients off thyroid hormone because I started treating the underlying cause of why they were hypothyroid, which was iodine deficiency. As a consequence of doing that, I started seeing women with fibrocystic breast disease get better, cystic ovaries get better, pancreatic cysts and tumors and things like that, doing better, and then, better, all the glandular tissue got better. And, the first book I wrote was Overcoming Thyroid Disorders, and about this, and I everything in that book still holds true, except now I add iodine to them. And my book on iodine, which is Iodine, Why You Need It, Why You Can't Live Without It. It's in its 5th edition. It sort of goes through this story, and it's transformed my practice. I am 25 years into using iodine, and if the government comes to me, says we don't like what you're doing, which they have done.
Sure they have.
At the state and the federal level, and my college, my med school, we don't like what you've done. and you better stop it all. And we'll give you one thing to take with you. Otherwise, you go back to doing conventional medicine where you don't practice. But you can take one thing with you. It would be iodine by far. It's an easy answer for me. It helps more people. It's inexpensive, and it's woefully deficient in our population right now.
That's incredible. Now, are the symptoms of iodine deficiency similar to thyroid deficiency, or how would one kind of know if
So iodine deficiency can lead to thyroid deficiency, because if you don't have enough iodine, you can't produce any hormone in the body, and that includes the adrenals, the ovaries, the pancreas, the thyroid. So yes, so iodine deficiency can lead to a diagnosis of hypothyroidism, but just as we talked about earlier, searching for the underlying cause of that is a better way to treat it. In this case, if it's iodine deficiency, treat it with iodine. And many times the hypothyroidism resolves itself.
Incredible. And is the testing, what's the testing like for knowing our iodine levels? What do we need to test?
What that article by Dr. Abraham was, he developed an iodine loading test. So there's a couple ways you can check iodine. I mean, one is you can do a spot urine iodine where you just pee in a cup, send it to the lab, they'll measure how much iodine's in there. That's a valid test if someone's not taking iodine, because we have reference ranges for that. What we don't have is reference ranges for someone taking iodine and then peeing in a cup. There's just we don't have them, so there's no reason to do that. And so the only functional test is what Dr. Abraham came up with, which was a 24-hour loading test. And that's a test where you collect 24 hours of urine before taking iodine, measure the iodine in that, take 50 milligrams of iodine, and then collect another 24 hours of urine and see how much iodine comes out of that urine in the next 24-hour collection. And then you just subtract the numbers, and you know how much you took in because you took in 50 milligrams. Iodine is cleared very nicely through the kidneys, almost all of it. And you figure out how deficient the body is. The more deficient the body is, the more of that 50 milligrams it holds on to. And the less deficient, the more you pee out. So what we determined was that on a 50 milligram loading test, if you have enough iodine in all your cells of your body, now keep in mind, we're not iodine camels. We don't have a hump holding iodine for when we're deficient in iodine. Iodine's used every day. We have no stores of iodine. So if you don't take iodine for a day or two, you start to become deficient. If you pee out 45 milligrams and hang on to 5 milligrams, that's a sign that the rest of your body has enough iodine in it, that you're getting rid of most of it, just 5 milligram pool to replenish what's needed on a daily basis. If you pee out, let's say 25 milligrams of 50, so 50% excretion, your body's hanging on to that other 50% because it's so deficient. And that's the best functional test there is out there for iodine.
Got it. Now, is iodine one of those supplements where we need to do it under doctor's supervision? Is it something if we take too much of it can be harmful? Can we just kind of supplement it? What's the take on that?
That's a good question. I think it's never good to be your own doctor. And I think it's best to have somebody who's iodine literate about iodine and iodine knowledgeable, can test you, can monitor you, and can treat you, and can give you, look, I tell my patients, you're driving the car. I'm just on the sidewalk yelling at you, turn left, go right, go straight. You decide where the car is going. If I say turn right and you turn left, I'll catch up over to that other sidewalk and keep yelling. And I said, we're working together on this. So this is a joint effort by both of us. And I do think it's better though to have an independent eye on things. And can you take too much iodine? You can take too much water. You can breathe too much oxygen. Pure oxygen cause problems with your lungs. Can you take too much iodine? If you have normal kidney function, you can take a ton of iodine and should be able to excrete it. Are some people sensitive to iodine? Absolutely. Some people are sensitive to magnesium.
Some people are sensitive to strawberries.
Yeah, that's right. So I think it's good to have an independent person, following you. And look, one of the best things about my job is, it's a personal interaction with the patients, but I always say to patients, this is why I'm still doing this, talking to them and seeing them, because, I feel like I have a nice relationship with them. And, but I like following their biochemistry. I mean, it's fascinating to me. And, you can look for trends, and you can look for changes, and you can intervene very quickly when you see changes before symptoms develop, that So can you take too much iodine? Yes, but and the bigger problem with iodine, and you and I talked about this before you started recording, is it's in the family of halides. In the periodic table, for those can remember back to chemistry in high school, the periodic table of elements, they're grouped into similar elements. Group 17 on the right side of the periodic table is the halides. And iodine is one of those halides, and so is bromide, fluoride, and chloride. Now, two of those halides, iodine and fluoride, are essential. You can't live without them. You don't get enough iodine, you don't get enough fluoride, you die. We get chloride from salt. We used to get iodine from some of our food and some of the plants grown in iodine-containing soil, but where I live, there's no iodine in the soil, or very little amounts. And the way we've over-farmed and over-pesticided and over-insecticided our soil, the iodine's been depleted out of the soil. The largest source of iodine's in the oceans, and we've polluted that enough that our iodine intake has gone way down. But of those halides, two of them are toxic halides. They're non-essential toxic halides. That's bromide and fluoride. And in our modern world, we get too much fluoride and too much bromide. Now, all these halides are competitive inhibitors of one another. Too much of one can push out too much of a non-essential one can push out an essential one. So too much bromide or fluoride can push out iodine. That's what we're having the problem with right now. Our exposure, bromide is an element that's in food and drink. It's in brominated vegetable oils and some sodas. It's a fire retardant in mattresses and curtains and carpet, and your shirt you're wearing probably has some bromide in it as a fire retardant. We're probably your rear end and my rear end is probably sitting on bromide cushion right now. These things have bromide in them. That's Patch the dog, the wonder dog.
It's
We were just wondering.
This is a man-made chemical, I'm assuming.
This is not a man-made chemical, but it's a man-used chemical.
Okay.
And it's in far too many consumer items, from food and drink to computers and mattresses.
Is it like fluoride, where there's the natural version of fluoride, the NaF, and then there's the chemical fluoride, which is a totally different compound? Is it?
So if we're talking elements, boron and fluoride. That's what they are. So right. Boron and fluoride, you don't just get boron and fluoride. They combine it with something chemically to put it in our environment. Right. So fluoride, there's sodium fluoride. There's a whole bunch of different forms of fluoride. So fluoride is the most electronegative element. It's a small element. It's very toxic to the human body. It's a carcinogenic element. They add it to our water supply because they told us that it prevents cavities. Well, when you look at the original studies in the US done in Grand Rapids and Muskegon, Grand Rapids was after World War II, the community, they fluoridated the water, and Muskegon was the control city.
The first experiment done on American children in the United States, in the world.
And
congratulations, Michigan.
Yeah, congratulations. So it was supposed to be, it's either the 11 or 15-year study, and they stopped the study early after 3 or 4 years or something like that, because they were saying that the Grand Rapids area was having less cavities. Now, this was after World War II. And if you look at cavity rates around the world after World War II, they were going down in every country. It's the same, whether they're fluoridated or not fluoridated. According to WHO statistics, if you look at a graph of all the Western countries, the cavity rate went down everywhere, whether it was fluoridated or non-fluoridated after World War II. And that's why today there's only 2 Western countries that primarily fluoridate their water. In the United States is one of the 2 of them. Every other Western country's gotten rid of it. Israel was the latest one to do it because, number one, they realized there was no difference in cavity rates in fluoridated and non-fluoridated areas. And number 2, fluoride's a toxic element that shouldn't be added to our water supply. That's pretty much a no-brainer once you study fluoride. But so this extra exposure of fluoride in our water, and now it's not just in our water, it's in our drinks, it's in our toothpaste, it's in, it's in drugs, it's in a lot of antidepressants, food, soil. And so we get this extra exposure as we become more modern. of fluoride and bromide at the same time iodine levels were declining in our soil and in our food supply. And I write in my iodine book that it's created a double whammy. It's a double whammy that lowered iodine levels dramatically. And the consequences we're facing with that are this epidemic of breast cancer affecting 1 in 7 women, prostate cancer affecting 1 in 3 men, thyroid cancer, the fastest growing cancer in the US, pancreatic cancer exploding at epidemic rates right now. Throw in uterine and ovarian cancer, and we've got a perfect storm of poor health in our country, which we all know people with all those illnesses, because and it's not, when I was in med school, in my training, I saw pancreatic cancer patients. They were old, or they were alcoholics, or they were doing something to their liver, or they were just old people who got this. I didn't see people in their 40s with pancreatic cancer, and I didn't see breast cancer. I don't want to use the word girls, but I didn't see girls who were late teenagers getting diagnosed with breast cancer at 18 years old, and women dying of breast cancer at 30 years old. I never saw that. And now I'm seeing men getting diagnosed with prostate cancer in their late 30s. I never saw that before. They were all old men back when I was in my training. And it's just a disaster that our captured government either just doesn't acknowledge, or they don't care. I'm not quite certain, but especially after COVID, I've become more jaded, with what's happened with that. And
money involved somewhere, probably.
captured
So with the fluoride, I've a lot of the newer NIH funded studies that are actually for the first time in history studying large cohorts of pregnant women and babies and the effects of fluoride. A lot of these studies were saying, and I noticed they were saying, well, this group was deficient in iodine, so they were more affected by the toxicity of fluoride. And that got me thinking. I was like, wait a minute. So iodine, so if you have iodine deficiency, the fluoride will affect your body in a more toxic way.
Correct.
Basically what these studies are saying. So if you take fluoride supplements, you're less susceptible to the toxicity of effects of fluoride.
If you take iodine supplements, that is correct. And it's the same problem with bromide, that the toxicity of bromide is accelerated when there's iodine deficiency. In my book, I did this with Dr. Abraham. I believe there were 9 patients in each group. I just took the first 9 women that came to me with breast cancer, and unfortunately, it's 1 in 7 women, so it doesn't take long to get 9 who have breast cancer. And I took 9 women who did not have breast cancer, and we did a 24-hour loading test where we measured their iodine and their fluoride levels and their bromide levels at time 0. We put them on 50 milligrams of iodine, then measured it 1 day later and 30 days later. And what the graph in the book shows is that the iodine levels in the breast cancer patients were 50% lower, about 50% lower than the non-breast cancer patients. And the bromide levels were 50% higher. Now, fluoride came equal in both groups, but fluoride's a weird element to study because it's so small, so electronegative, and so toxic to the human body that we have mechanisms in our body to try and push fluoride away. So, because whenever it's free in the bloodstream, it's wreaking havoc. It's a strong oxidant that will destroy so many enzymes in the body that we try and push it away into our bones, into our teeth, and to other areas where we can just store it away. And so we didn't see the difference in fluoride, but we saw that difference in bromide and iodine. And you and I have talked because you wrote a series on fluoride for Epoch Times. Now, let me ask you a question. Is it Epoch Times or is it Epoch Times?
Yes. When I first started working for them, I had to Google it. It's Epoch Times.
It's what it's spelled, Epoch Times. I don't understand this whole Epoch.
I used to always call it Epoch Times. I was like, the Epoch Times. And then I was like, wait, they actually explain it. It's the premise of the whole movement and the whole the paper. It's quite fascinating. It was started by a gentleman coming over here to get his doctorate from China and experiencing non-communism for the first time in his life, and basically started it to prevent communism from spreading around the globe and to bring awareness and battle that. So essentially.
Epic is the right word. That's
Epic is the right word. Epic Times. Yes. Yes.
So you wrote a series on fluoride, which I found fascinating, and the government. You could tell the story better than I have because you just wrote the series on it. But the government just released its national toxicity. What's the name of the organization?
NTP, the National
NTP.
Toxicity Program. Yeah.
And they just released their fluoride report, which should have been released 2 years ago, and the government stepped in and delayed it because it shows fluoride is toxic and in dose, and it shouldn't be in our water supply. And they try to water it down, and the scientists who wrote the article refused to change their conclusions to it. And there's a case going on in federal court right now that hopefully the judge will decide, because it's pretty clear now that, I mean, I don't see how the judge can't decide fluoride's a toxic thing, and then we'll see what happens. And look, if this comes through and they rule fluoride as toxic, what the hell are they going to say to us? They've been doing since 1950, fluoridating our water without any data, good data to do that. And it's just been it's another one look, in med school, you would have asked me, I would have said, hey, fluoride prevents cavities. It's one of the best public health initiatives we've ever done. Of course, I never knew about Grand Rapids and Muskegon, and I never read the studies, and I never pulled the information on it, but that's what I would have told you. And then once I had my epiphany, I started questioning everything. I started reading about everything, and it's really sad out there what's happened. But there's enough of us out there who are awakened and who are ringing the bell. And I think that COVID has sort of pushed things over the edge now, that people are questioning everything right now, and they're looking for answers, and they're looking for truth.
They're realizing
there's misinformation out there left and right, and
there's fake science. There are people that are straight, their job is to create fake science, and it's quite
Florida is fake science, man.
Yeah.
Florida and our water supply, that's a perfect example of fake science.
Absolutely. And I've always called myself a water snob. I've always done the Kangen water, or I've done distilled water, added my own minerals back, and I've never, I was like, oh, I'm going to avoid fluoride, but I never really knew much about it until I started this series. And now I'm just like, I mean, it was one moment of being completely mind-blowing.
Yeah. Well, there's many moments in my career, mercury, I didn't know anything about mercury in med school. I don't even think we learned about it. So, one thing leads to another in holistic medicine. You learn about mercury, and there's mercury in childhood vaccines. Like, the hell's that? Like, mercury is the second most toxic element known to mankind. You don't need to know much about mercury, except it's like uranium. If it's that toxic to the human body, perhaps we shouldn't be injecting it into anybody, any living being, or particularly our kids. And you put mercury in fillings in the mouth, and you say, well, that's safe to do. It's inert, and it won't release from the once you put it in there, which it's a lie, because we know that it releases from there. We know people with more fillings have more mercury in their body, and I don't think it requires any randomized double-blind controlled studies to say, wearing a parachute if you jump out of a plane is better than jumping out of a plane without a parachute. Nor do you need any randomized double-blind placebo-controlled studies saying, maybe comparing mercury fillings to non-mercury fillings and seeing what the health aspects are. I don't think we need much study on that. And but that's another.
That's the government. It's kind of like, well, let's have a meeting about a meeting, and let's do a study on the studies, and then we'll do another study on that study on the studies, and we'll just keep talking about it for about 10 years. Meanwhile, we're all making money off it. It's interesting. Well, what's your opinion on the whole? This is a global issue, the iodine issue. It's everybody's becoming deficient. It's almost 50% in the world. You mentioned, our soil is depleted. Are those kind of the root causes, you think, of the iodine deficiency issues?
Well, in my testing, I would say the numbers are over 95% of people are depleted in iodine, and it's the reason the numbers are lower in what you're quoting is because people just aren't tested. So we've been testing people since 2000, a little before 2000, 25 years or so. And we have thousands of we're somewhere over 8,000. I got to count them. I count them every 6 months or so, but 8,000 to 9,000 people we've tested, and well over 95% are low in iodine. I think it's 97 point some odd percent. So it's look, there's these levels of vitamin C and iodine and thiamine and other things were established from the RDA, the recommended daily allowance. They weren't optimal levels. They were minimal levels to prevent disease, to prevent signs of disease. So the vitamin C, which I don't know if I think it's at 75 milligrams or maybe 90 milligrams now per day, something like that. That's not an optimal amount of vitamin C. If you get sick with COVID or you get sick with a cold or flu or something, your vitamin C requirements go way up at that point. You know, it's the minimal level to prevent scurvy and bleeding of your gums and your bones falling apart and your arteries leaking and things like that. So the iodine of 150 micrograms per day as the RDA for iodine was established because it was the minimal amount after studies were done in animals, to look at, you know, what changed the animals so they could procreate better and grow to the right size. And the minimal amount of iodine into animal food, they estimated the same amount to humans and basically used that data to say 150 micrograms of iodine per day is the RDA for iodine. That's not the optimal amount. So that's the minimal amount where people won't get goiter of the thyroid, the vast majority of people. Although goiter of the thyroid is still occurring at a huge rate, it's because doctors don't know how to feel the thyroid anymore. They're just ordering lab tests and they're not really touching their patients enough, and they're not palpating well enough to feel the thyroid, because I'm pretty good at feeling the thyroid. I feel a lot of goiters out there, a lot of swollen thyroids. And when I lecture to doctors and med students, I teach them, we stop in the middle of the lecture and I make them pair up with each other. And I'm like, this is how I palpate the thyroid. I was not taught this in med school. This is my own method that I learned to do that I find much more efficient from what I was taught in med school. And I can feel down to 0.3 to 0.5 millimeters cysts and nodules in the thyroid, which is much smaller than I was feeling the way I was taught in med school. So there's minimal levels and there's optimal levels of nutrients, and a holistic minded practitioner will look at optimal levels of these nutrients, not the minimal levels.
Right. Now you mentioned our soils depleted, but are there food sources we can all be eating that do maybe hopefully have some iodine in them? And then you said Lugol's was the one we need to be taking. Is there a specific, brand or place to buy it? We can look for this that's reputable.
So it's best to get your nutrients from food. You know, you should eat an organic diet. There's more nutrients in an organic diet. It's less pesticides and insecticides, hopefully, in the organic food, and it should be healthier food than, conventionally raised food. So in a perfect world, that's where we should be getting our nutrients from. And the problem is we're not in a perfect world. And as I mentioned, with fluoride and bromide competitively inhibiting iodine, there's a whole bunch of factors that there's just not enough. And there's been studies showing that nutrient levels have been falling in our food over the last few decades. So it's impossible in our toxic world to get enough iodine from food. You just can't. So I believe you're going to need to supplement with it. So I believe if you're going to use iodine, a combination of iodine and iodide will tackle the receptors of the body that need iodine and iodide. Lugol solution was designed in the 1800s from Dr. Lugol. It's a solution of potassium iodide and iodine, and there's tableted Lugol solution that's out there. And again, it's worth it to work with a iodine literate practitioner just to help guide you with this and test you and follow you with this.
Absolutely. Thanks for sharing that. Now there's another layer to this. You wrote a book on salt as well. How does our salt or sodium levels affect iodine absorption, and what kind of salts do we specifically need to be ingesting?
So I wrote a book, Salt Your Way to Health. And what I find through checking chemistries on everybody is most people are salt deficient. My patients know I'm always harping on them, how much salt do they eat? And there's good salt and bad salt. And good salt is unrefined salt. It has a full complement of minerals in it. Refined salt is not good salt. The minerals have been taken out of it. It's sodium and chloride only, with some toxic additives added to it, such as ferrous cyanide and aluminum. And that kind of salt is a real thin white stuff that you see in the restaurants you can pour out a lot of it because it's so thin. The unrefined salt is a little bit thicker and it's got some color to it from the minerals in it. So salt in the old days of medicine, which was probably 100 years ago, around then, there was a lot of drugs they used to use that have bromine as part of their chemical makeup. I don't think you're old enough to remember, but I remember Bromo-Seltzer. It's Alka-Seltzer now. Bromo-Seltzer had bromine in it, and people could OD on bromine, taking some of this stuff. So they would show up to the emergency room delirious, fainting, they can't walk. And they were diagnosed with bromine toxicity. And what the treatment for it at that time, and still today, if that happens, is to salt the bromine out. So you would use salt, an IV of salt, sodium chloride. And the reason for that is chloride is part of the halide family, and enough chloride will competitively inhibit bromide. So you would salt the bromide out with chloride. And so when I started using iodine, I had already been using salt. I realized people were salt deficient before that. But what I found was when people started using iodine, if they weren't on salt, sometimes they would get reactions which they attributed to iodine. They would get nervous or jittery or headachy or whatever. And they'd say, well, I have an allergy to iodine, or I can't take iodine, or it's making my thyroid screwy. And that wasn't really the case. What was happening to the vast majority of them was that when they took iodine, they were displacing bromide and or fluoride, bromide plus or minus fluoride, but they were becoming toxic on bromide, and they needed salt to be able to usher that bromide out appropriately while they took iodine. So I find that taking salt with iodine really minimizes the side effects of bromide toxicity that is bound to occur in our modern world and our exposure to bromide. So I wrote that book, Salt Your Way to Health, to help. Look, the reason I wrote all these, I have 17 books now. I just actually came out with one more.
Oh, what's a new one?
The new one is on leaky gut. It's part 2 of my leaky gut series. And that just literally, we just finished it. But I wrote the salt book, and I wrote the iodine book, and the thyroid book, and my, whatever, statin book. I've written a whole bunch of them that to educate people on. Yeah, I find if you're my patient, that if the more educated you are, the better our relationship is, and the better decisions you're going to make for your healthcare. Like I said, you're driving the car. I'm just yelling at you from the sideline, telling you turn left, go right, go straight. You make your decisions. And you know what? If you can educate yourself, and if you can think clearly, which is hard to do these days, people don't want to be tired. They don't want to have headaches. They don't want to have the hair loss. They don't want to have weight gain. They want to feel good. Good health is possible, but I think you got to take an active role in it, especially in today's world.
Absolutely. And it's good to hear somebody talking about salt, because I feel like there's been a war on salt for so long. Don't eat too much salt. And
The major constituent in the human body is salt. Number 1 is water.
Yeah, we need salt as well.
One of the 2 things you want to maintain in life, you want to maintain adequate hydration at all times. You want to maintain adequate salt levels.
Right.
Let me tell you,
I've always said if there's no apocalypse.
What killed a lot of COVID people was dehydration and hyponatremia, low salt levels. I can tell you that. We were giving people IVs of saline all the time for COVID, and outside in Michigan in March and April in the wintertime, we were running in IVs all the time. And it was one of the most helpful things we did for people, is maintain, help them get their hydration back and their salt levels back.
The electrolytes. I did a paper for the Epoch Times on that, article about, they finding the insanely low electrolytes in people with severe COVID, and they weren't testing for that.
Absolutely.
Now I want to talk about one more book you wrote, because this ties into iodine as well. And it's important to me because I have family on statins, and I'm always like, I don't know about statins. So you wrote a book, The Statin Disaster. What's the relationship between our thyroid function, iodine levels, and cholesterol? And what do we need to know about statins and this mainstream kind of approach of treating cholesterol?
I was just looking for a copy of it, which I don't have in my hands, but it's called The Statin Disaster, so you can guess what my views are on statins. So statins poison an enzyme called HMG-CoA reductase, and they lower cholesterol levels, no doubt. If you want your cholesterol lower, take a statin drug, and they work. So HMG-CoA reductase is the rate-limiting enzyme to making cholesterol in the human body. The problem with doing that model is, if you look at the biochemical pathway of cholesterol being here, all the things downstream from cholesterol include CoQ10, testosterone, estrogen, progesterone, DHEA, pregnenolone, all these adrenal and sex hormones that we need to live. And so when you take a statin drug and poison that enzyme and lower cholesterol levels, well, you're going to lower everything else below that too. And there's no wonder that statins are associated with side effects like congestive heart failure, cardiomyopathy, ALS, or Lou Gehrig's disease, fatigue, brain fog, other things. And so the question to ask is, okay, so the cholesterol's elevated. Is it a statin deficiency syndrome? I haven't seen one yet. I've been looking for one, but could it be you're eating a poor diet? Could it be you're nutritionally deficient? Could it be you're thyroid deficient? Could it be you're iodine deficient, causing the thyroid deficiency? So treating the underlying cause of the problem, helps out more. And, I know there's controversy on, statins causing muscle injuries and myopathies and congestive heart failure and all that other stuff. But there are case histories in literature of this. And I think when you look at what cholesterol and the downstream metabolites do in the body, you would expect things like those illnesses to, increase the risk when you're taking a statin drug. So I have yet to see a statin deficiency syndrome out there. Therefore, I have yet to.
Not a nutrient. Good to know. So thank you so much. This was really informative. For those listening that would like to learn more about your work and your books, where can we find you? And do you have any other resources we can all check out?
You can go to my website. It's drbrownstein.com. It's Dr. Brownstein, BROWNSTEIN.com. And, our office is in West Bloomfield, Michigan. And there's 6 practitioners. My daughter is graduating residency in 2 weeks now. She'll be a full-time practitioner in 2 weeks. And her sister will be 1 year out coming. And I've been with my 2 partners, Dr. Ng and Dr. Nussbaum, for a long time. And, we've been there together, and we're all on the same page. And we have another ER doctor, Dr. Lepak, who's joined us. And I have a PA, Jessica Gross. And as I said, when I wanted to leave that office, I need the front desk. I need the file person. I need the other practitioners. We're all on the same page. We are all on the same page, and we have fun doing what we do. And it's an honor to do it. And it's a good way to practice medicine.
Absolutely. We need many, many more of you. Well, I'll post a link below to all your website and books and resources so everybody can check all that out. And thank you so much for joining me today and sharing this really important information about iodine and all your research you've done over the years. We definitely need more doctors like you. Maybe you could start your own med school. Aside from what's that?
I don't think they'll accept that. But I thank you for having me on the show, Christy, and let's talk again.
Absolutely. Before we wrap it up, do you have any final thoughts for those listening around holistic health, or for any maybe doctors that kind of want to switch into the holistic health side?
Patients out there, I would say, look, you don't have to suffer with poor health. If you're not getting answers, you're not happy, move around. I mean, look, it's not like I've helped every person out there that I've seen. And, but I think that, primarily relying on drug therapies that, most drugs work by poisoning enzymes and blocking receptors in the body. That's not good long-term medicine. There's a time and a place for that stuff. And you have an acute heart attack or acute stroke, conventional medicine can really help. And there are some good therapies that poison enzymes and block receptors acutely. But for long-time therapy, you need support. We need to support the immune system. We need to support the body. And we need to support the immune system and support the body so it doesn't develop these long-term diseases and these acute diseases. And I've seen this play out in my practice over 30 years. And if you're not getting answers, it's time to search and time to educate yourself. And once you educate yourself, you'll know what you're looking for at that point. And that's why I started writing those books. 25 years ago, really, today, actually.
Definitely go check out his books. Well, thank you so much again, Dr. Brownstein.
Thanks, Christy.
If you like this video, please like and share with others. This information could really help someone you may know. If you haven't already, also hit that subscribe button to be sure you don't miss out on our future shows. And I'll see you all next Wednesday on our next episode of Discovering True Health.